thank you all for joining us. So my name is Michelle Oliver. I'm the Public Relations Coordinator for the Merced County Sheriff's Office. And I would just like to remind you guys that please silence your cell phones. If you have any questions, we will have a Q&A answer after everybody has gone through their speeches. And if you don't mind, I'm going to go ahead and introduce a couple people who are standing behind me. So first, I would like to introduce California Highway Patrol Captain John Starica. To my right, California Attorney General Rob Bonta. Right behind me. Merced County District Attorney Nicole Silvera. Also to my right. And then we have Merced County Sheriff Vern Warnke over to my left. And then we're going to go ahead and start with California Highway Patrol Captain John Starica.
Good morning, everyone. Thank you for having me. My name is Captain John Starica with California Highway Patrol. I'm the commander of the Central Division Special Operations Command, and part of that command is our K-9 program, and that's one of the reasons why we're here, to discuss the operations of that particular unit. The Central Division CHP K-9 unit is comprised of 6 CHP K-9 units of the officer and the K-9 that work collaboratively over the areas of the state freeways, highways, and roadways in the communities within Central Division. Central Division incorporates areas from Modesto to the Grapevine. The mission of the California Highway Patrol is to provide the highest level of safety, service, and security to the people of California. Part of that mission and statement is looking and combating illicit drugs that travel on the roadways in California. However, this is not a California Highway Patrol problem only. We can only do this through strong partnerships, and many of our partners are here with us. And I'd like to specifically point out these partners with us. The California Department of Justice, the Attorney General, Rob Bonta, Merced County District Attorney Nicole Silvera, Merced County Sheriff Vern Warnke, and the Merced Area Gang Narcotic Enforcement Team, who on April 25th and April 27th of this year, CHP K-9 units on both State Route 99 and Interstate 5 made traffic stops on vehicles, which subsequently were determined to have illicit drugs, specifically fentanyl. Once determined that these vehicles had these illegal drugs on board, we called the Merced Area Gang and our Narcotic Enforcement Team and turned the case over to them. Those investigators subsequently took the case, and that's going to be discussed by the speakers behind us. We again appreciate from the California Highway Patrol's side the partnerships that we have, and with that, I'm going to turn it over to one of our strongest partners in California, Attorney General Rob Bonta.
Thank you, Captain, and good afternoon, everyone. I want to start with a huge expression of gratitude for the team assembled here, for their broader teams that are not up here at this moment, but who did this important work every day, investigating, detecting, holding folks accountable. We did this as a team, multi-jurisdictions, working together, focused on a common goal, and I'm very proud of that fact. And proud to do the small part that we had in it as well as part of a larger team effort. So let me first thank our partners at CHP. Thank you for the being first on the ground here, for the important efforts to investigate and detect, to reach out to us, and our broader collaboration to assist. We're proud to have assisted you, and thank you for everything that you've done in the front lines. We've been working with the CHP on a lot of efforts regarding law enforcement, certainly drug interdiction, also organized retail crime, and other efforts, and always a proud and grateful partner with the CHP. So thank you for your work. Thank you to the Merced County Sheriff's Office, who provided important on-the-ground support. Proud to be a partner with you, and thank you to everyone involved in the Merced Area Gang Narcotics Enforcement Team. We call it Magnet, as you know, including my team at DOJ. I always want to thank them for the work that they do every day. They don't do it for the credit or the recognition, but I want to thank them for the work that they do. It's important for the people of California. Thank you to Homeland Security. Thank you to the California Department of Corrections and Rehabilitation Special Services Unit, the Merced Police Department, Merced County Sheriff's Office, County Probation Department, and County DA's Office, Los Baños Police Department. Again, the CHP, Drug Enforcement Administration, and the FBI. So as you can tell, there are a lot of different departments and agencies, personnel, team members that combined for the results that we're talking about today. Certainly an impressive list of leaders, law enforcement providers who are doing impressive work. And it's because of the dedication and leadership of this group, this multi-agency alliance, that we were able to seize 40 pounds of fentanyl, 104 pounds of methamphetamine, and arrest 7 suspects before another Californian could be hurt by those drugs or worse. And, you know, I certainly come at this work as the proud leader of the California Department of Justice, the largest state Department of Justice in the nation, as the Attorney General. But I think, like a lot of us up here, I also see it as a husband and a father of 3. There is nothing scarier than the thought of one of my children being hurt or harmed. And across our state and nation, we're witnessing a devastating rise in young people dying by accidental overdose of fentanyl. And my heart breaks for all the parents and loved ones who've lost a child, who get that unfathomable, unimaginable call. Fentanyl is different than other drugs that we have interacted with and interdicted and provided enforcement for. It's cheap, it's very, very potent, and it's lethal. That's why drug traffickers, like the suspects we arrested in these cases, are lacing fentanyl into other drugs, pressing it into pills designed to look like prescription drugs. These drugs, whether in pill or in powder, are deadly. And none of us up here today can bring back the loved ones lost, but we can stand united and recommit to the important work ahead of us to get these drugs out of our communities, to get dealers off our streets, to put an end to this deadly trend, to dismantle the organized criminal groups that are bringing fentanyl into California. And that's exactly what we're doing. This is an example of outstanding law enforcement, working together, detecting drug interdiction, and again, preventing it before it could reach those who it might harm. Each of us has a slightly different function, a different jurisdiction. We wear different uniforms, but we are committed to a common mission, a common value, that public safety is job number 1, 2, and 3. And that's why I know we'll have more days like this. We're announcing the important results of a law enforcement operation, because each of us will make sure of it. We'll continue that commitment, that teaming up. And the people of California, they deserve this. They deserve partnership, collaboration, each of us doing more together than we could do alone. The times, the challenges, they require that. And so we're doing our best to meet the moment, whether it's getting illicit drugs out of our neighborhoods, disrupting and dismantling criminal fentanyl operations, or keeping our kids and our community safe. DOJ is all in, and I know our partners at Magnet are as well. So thank you again to everyone who made this success that we're announcing today possible, and I look forward to more days like this, to continuing to do this important work together. And with that, it's my pleasure and honor to introduce Merced County District Attorney Nicole Silvera.
Thank you. Good afternoon. I'm going to talk to all of you a little bit about what we were able to charge the defendants with and the potential sentences that they're looking at. So we have charged all 7 defendants involved in these 2 incidents to the fullest extent of the law. Currently in California, there are no large quantity enhancements for fentanyl, so the punishment for the transportation of fentanyl is actually less than that of the methamphetamine. And furthermore, all the sentences that I'm going to talk to you about are to be served in local jail as opposed to state prison. In the case involving the stop on April 25th, all defendants, all 4 of them, are ineligible for probation due to the large amount of methamphetamine that they were transporting, and as charged, could face up to 26 years in local prison. This is the largest amount of time based on the law, but we also have to take into account many circumstances, including the fact that these sentences are going to be served locally, and we have to think about the number of people that are awaiting trial currently in our jail. And as I said, there's no enhancement for the large quantities of fentanyl, even though it is extremely dangerous and deadly, which brings us to the case on April 27th. In that case, 3 defendants had in their possession 58,000 pills that were laced with fentanyl. We all know that 1 pill can kill. So we are talking about the potential to kill 58,000 people that was traveling here in Merced County. The defendants in this case could face anything from probation up to 9 years in local prison. It's important to note that one of the defendants in that case is currently on probation for the same crime that he was arrested for in this case, transportation or sale of a controlled substance. Fentanyl is the silent killer that lives among us, and the district attorney's office will not associate any criminal activity surrounding fentanyl in Merced County. We commend all agencies involved in their effort to combat this drug. Specifically in this case, the Merced Sheriff's Office, including Sheriff Vern Warnke, the California Highway Patrol, and the Merced Area Gangs and Narcotics Enforcement Team. Task forces are instrumental in this fight against fentanyl, and we cannot succeed without them. And lastly, and certainly not least, I want to extend my gratitude to Attorney General Bonta for his attention to this public safety and health crisis across California and his attention to the people in Merced County. So we thank you very much.
All right, at this time, we'd like to open it up for any questions that you may have for any of our speakers or anybody behind me.
What's the amount, street value of what was taken?
I'll defer to law enforcement.
Retail value is I'm Special Agent Supervisor of and the commander for the task force here. My name is Aaron Hutchison. Street value approximately is about $3 million retail with the pills that was removed. Off the top of my head for fentanyl, I want to say it's about not fentanyl, the meth is about 1.1 million. Does that answer that question?
Last year I seen that we got a new dog. Will we see more canines? And then within that year, how many stops? Because it seems like down the 99 and the 5, you guys just went out, once after once, it seems like you guys pull somebody over. Do you see it on Facebook?
So the California Highway Patrol, to answer your question, remains committed to our canine program. We're always looking for funding, resources, and training opportunities to increase the number of canine units that we deploy throughout the state. Currently in Central Division, we have 6 canine units that work specifically towards the detection of narcotics on our roadways. We are looking to, at some point, add to those numbers. However, it is a matter of staffing and funding, and we're always looking for resources and opportunities to increase those numbers. But I will say that the units and the canine partners that we do have out in the fields, they do a spectacular job with the numbers that they have. And you're correct. You will see them on all the different roadways, Interstate 5, State Route 99, and any roadway that the California Highway Patrol is specifically provided for jurisdiction.
What message do you want to tell this webcast?
Well, from the California Highway Patrol, and I think I can speak for all the partners that you see up here, we remain committed to the eradication, the detection, and the removal from this dangerous product from our roadways. So from the California Highway Patrol's aspect or angle, we remain committed to our mission statement of providing the highest level of safety, service, and security. And doing that, part of that message is working with our partners removing fentanyl from the streets of California.
Were all these narcotics seized on 2 stops?
For this particular event, yes, the 2 stops occurred on April 25th on State Route 99 and on April 27th on Interstate 5. So for this particular, what we're discussing today, all the totals that were provided were from those 2 stops.
In these past several years, why have we seen such a dramatic increase in fentanyl on the streets? Has the form changed of how people are ingesting the drug?
You want to speak on that? Aaron?
Sure.
I'm going to defer to Aaron on this.
I'm sorry, can you rephrase that one more time?
In the past several years, we've seen a dramatic increase on overdoses related to fentanyl. And why are we seeing that? Has the form in fentanyl changed in the way people are ingesting the drugs perhaps?
No, really it comes down to what the Attorney General Bonta stated as the cheapness of it. It's cheaper and easier to, one, get a hold of nowadays. But unfortunately, though, too, this isn't made, by chemists. or used in the medical practice. This is used illicitly, illegally, and unfortunately, again, if you don't have a trained person making this, that's where that danger comes in for the overdose stuff that you're talking about. So that, as again to the district attorney said, that one pill, you're kind of gambling your life when you take that. So unfortunately, again, with the cheapness of it and the way it's being processed and brought over and smuggled into, it's been easier for those cartels and organizations compared to the other stuff such as like heroin and different things that are easier too for K9 to detect, and along with our federal partners at the border too to protect, detect. So it's been, again, easier for those cartels to bring them here, manufacture them here, and to sell cheaper than the other street drugs. It's Aaron Hutchison.
Sheriff, is this the new drug? I remember when I first started 20 years ago, we were always at meth bust over and over.
Over and over. Now, methamphetamine is still prevalent, but it's not being manufactured mostly in the United States. It's being manufactured in our southern borders. With the fentanyl, the issue with that is that, the meth is dangerous enough as it is, but just handling fentanyl, you can ingest it just handling it. So new protocols have been set up. We're actually training our canines. We're bringing in synthetic fentanyl to detect. And I think we got 3 of them being brought in and or being trained as we speak. So, yeah, meth was it. And the substantial difference here is there was a while when I was a sergeant in charge of our undercover unit. Merced County was #1 in the nation for meth product. I'm glad we no longer have that distinction, but yeah, we're dealing with this new drug, and it's everywhere. It's being laced into everything. We're finding it in our local prisons. It's a horrible thing, and people are dying regularly from it. And I'm hoping that our legislators up in Sacramento decide to do something different as far as not having this as categorized as they would do with meth. I'd like to see this on an upper end of it. So if somebody's got possession of meth for sale, start thinking about felony charges and tougher penalties other than local jail time.
So to answer your question, the question was being the use of the corridors, specifically the major north-south corridors of California, which is State Route 99 and Interstate 5. There's a high volume of traffic on both of those roadways. Anyone that's ever driven on 99 or I-5, they understand the volume of cars. And so the officers that are out there, they're highly trained, but they have to be able to try to detect these vehicles and find a reason that, a reason to make a stop, and then go from there in their investigation. Show the sheer numbers of the vehicles will sometimes be to the advantage of some of these traffickers. However, because of our partners, because of the commitment of the California Highway Patrol in detecting these drugs on the roadways, we make it a very important aspect of our job in special operations and CHP to go through those numbers, weed through the statistics of how many vehicles are out there, and find these traffickers. And the proof is in the pudding. In these 2 stops, out of all the thousands of cars that were on the roadway that day, we found the 2 cars that had, all this weight in fentanyl. So we think that we're being successful. However, we know there's work to be done.
And where are they taking the drugs from and to?
Well, in this example, I can speak that they're going from south to north. Their final destination, that's for speculation. We know they're coming from south of Merced County during this investigation where they were stopped. They're originating. I would have to turn that over to the investigating task force if they know that.
Just unfortunately, due to the investigation this time, we can't really share because it's ongoing. But we have seen through other investigations that yes, it normally will come from Southern California and move north through Merced and even north into the other 2 states close to us, which is Washington and Oregon. So.
Question is for Attorney General.
So your question is for the legislature and the governor more generally. From where I stand and the observations that I've seen, I know there's a lot of discussion, bill proposals, ideas to address the fentanyl challenges and risks generally, coming at it from a lot of different perspectives, accountability and criminal accountability, one public health side as well. I think we know that this is a public health issue as well as a criminal justice issue. And there have been proposals to bring fentanyl up to some of the same criminal accountability as other drugs, and some even more beyond that, given the nature of the crisis. And, you know, we've seen different drugs at different times really hurt our communities. Right now we're seeing a spike and rise in the impacts of fentanyl. As discussed, it's cheap, it's potent, it's addictive, and along with the potency comes its deadliness. And so there's special committees, or select committees that are reviewing this issue. There are public safety committees that are receiving different proposals for what to do next. And in the meanwhile, you know, on the law enforcement side, I think it's super important to detect and deter, disrupt, dismantle operations as high upstream as we can, at the point of entry into our state, if possible, at ports and other locations, to stop it from coming into our community in the first place. And if it gets in and is starting to be distributed through the major arteries like I-5 and 99, as we discussed, which have been common for the movement of drugs over many years, to stop it then, before it gets into the communities, before it gets into someone's hands. That's an important role that we can play. The legislature and the governor will continue to play their role on identifying and implementing other solutions. You know, I think data, evidence, the experience of sentencing when it comes to other drugs and including fentanyl is important. That question is answered by the data. Does increasing a sentence from 5 to 7 to 10 move the needle and change the behavior? It might, and if it does, that should be pursued. But I think it should be data-based. And a lot of the behavior that we know when it comes to criminal justice is folks who may engage in criminal conduct are more likely to be deterred by it if they know that they will be arrested when they commit a crime. And so we need to arrest people. We need to do what we're doing today. This was important. We detected it. We arrested them. They are being held accountable. They will have 9 to 26 years possible for all the charges. That's important. Now, can more additional enhancements move the needle even more? If they can, they should be pursued. But it should be based on the data, I believe. And I think that this is it's not just one solution here. There's not a simple panacea. If you made all of give everyone life in prison or the death penalty, would that end the scourge of fentanyl? I don't know that it would. I think we need our interdiction operations. We need the public health components too. My office has been suing different companies and who were involved in the opioid epidemic, and bringing in $2 billion worth of resources into California for prevention, for education, for rehabilitation, for treatment, to address addiction. That's an important part of the public health side as well. So it's sort of all of the above, and that certainly could include enhancements. I think it's more than that as well, too.
We do have somebody in this case that is already a repeat offender. So how necessary does that enhancement have to be? I mean, obviously, I know that you said it's the governing legislation, but I'm sure your office has some sort of plan to further that process.
You know, my general view is the accountability should be proportionate to the conduct. More serious crime, more serious criminal conduct, more serious consequences. Less serious, proportionate consequences. Repeat offenders is more serious. They have committed a crime already, and yet they're doing it again. There should be more serious consequences for that. So a proportionate approach that sees the conduct for what it is and provides the appropriate response in terms of criminal accountability, I think is the way to go. Thank you.
Silvera, correct?
Silvera.
Silvera. I mean, how do you feel from a DA's perspective that there are no enhancements?
I feel there should be enhancements. Given the dangerous and deadly nature of this substance, there should be a deterrent, and it should be at least treated, fentanyl should at least be treated equally, if not heavier, than some of the other narcotics that we're dealing with. Last week, I was in Sacramento with Assemblywoman Soria to testify on a bill which would add fentanyl to a class of crimes that punishes drug possession and possession of a loaded weapon as a felony. Currently, if you have fentanyl and you have a loaded gun, that's not a felony. That's just 2 misdemeanors. And so that's a step that our representative here locally at a state level is taking, and her bill did make it out of the Public Safety Committee and is going forward. But I was there when a lot of other bills were being pushed, and they weren't given the same opportunity to go on. So I am fighting for stronger enhancements and doing as much work as I can with our representatives to move towards that. I don't know comparatively, but I can tell you that for the last 2 years in a row, there has been 22 deaths each year due to fentanyl. And so when you're looking at that compared to our murder rates in 2021, we had 28 homicides, and in 2022 we had 35, which is unprecedented for this county. So the overdose rate of fentanyl is starting to rival our homicide rate here in Merced, and that's extremely frightening, and it needs to be taken seriously.